Regression of glioblastoma after chimeric antigen receptor T-cell therapy. First of all, we need the definition of a glioblastoma. A glioblastoma is an aggressive primary brain tumor that is among the most lethal of human cancers. Here we have a video of a neurosurgeon explaining what is a glioblastoma and why it is so deadly.
Unfortunately, another type of tumor that we frequently see is a very highly malignant brain tumor called a glioblastoma multiforme, a GBM. That tumor is very difficult to treat in the long run. It's oftentimes not very difficult to do surgery on because we can typically remove a very high percentage of the GBM. However, the problem is that up to 2 centimeters away from what you can see in the brain and what you can see on an X-ray, there's little tiny microscopic foci of tumor that haven't yet grown. So we can take out everything we see, but there's still GBM lurking that is going to grow again.
Then we have a video of a look at how CAR T-cells therapy works.
The immune system defends the body against disease. T cells are one of its key soldiers, targeting infected or abnormal cells. But cancer can block those defenses. Now scientists are genetically engineering patients' own T cells to make them smarter and tougher at seeking out and destroying cancer. One version is called CAR T cell therapy. T cells customized to zero in on a patient's specific kind of cancer. It all starts when a patient's blood is filtered through a machine that separates T cells and other white blood cells from the rest. Scientists mix the collected T cells with a virus that has been disabled so it won't cause illness. Instead, that virus carries genetic instructions for the T cells to grow an artificial receptor called a chimeric antigen receptor, or CAR, that will track its cancer target and rev up for an attack. Millions of copies of those engineered cells are grown in a laboratory and given back to the patient intravenously. The first CAR T cells are being tested against types of leukemia and lymphoma that bear a marker, or antigen, named CD19. Once in the bloodstream, those CAR T cells home in on that antigen and grab hold.
Then we have another video of manufacturing CAR T cells therapy, the Novartis approach. Moving on, we have the applications in medicine. Chimeric antigen receptor T-cell therapy. The administration of CD8 T-cells expressing a first-generation IL-13R2 target CAR in patients with glioblastoma showed transient anti-glioma responses with no high therapy-related side effects. Then we have the results of glioblastoma clinical trial showing the safety and the clinical benefit of the CAR T-cell therapy. And next we have the pros and cons. The pros. CAR-engineered T-cells recognize tumor cells and attack them directly. There are no high-grade therapies-related side effects, and this study has helped thousands of patients. Cons. The efficacy of this therapy against solid tumors remains to be established, and they are available to patients who participate in a clinical trial varies. Then we have a video of why is glioblastoma so deadly.
Well, glioblastoma is the most common and severe form of brain cancer. It's a cancer that develops in the tissue that surrounds the neurons in the brain. And it tends to be very aggressive and grows very rapidly. And unfortunately, even with today's best standard of care, most patients don't live much beyond 18 months from their diagnosis. The only drugs that have been successful in shrinking the tumor and extending life to date are called alkylating agents. And the challenge is that the drugs that are out there today generally work through the same mechanism. And so patients who become resistant to one are resistant to the next. And unfortunately, most patients do become resistant or don't respond to today's chemotherapy.
Then we have the issue of light inequity. The incidence of this type of brain tumor is approximately 3 to 4 cases per 100,000 inhabitants per year, which translates into about 240,000 diagnoses per year. Conclusion. Due to the advance of technology that has passed through these years, we are now able to treat such an aggressive type of cancer that has killed many people because of the lack of resources. This is a really good benefit that medicine has brought to people that are involved in cancer diseases.